In this presentation, we're going to be reviewing Xopenex or levalbuterol. Xopenex was approved by the Southern Nevada Health District's Medical Advisory Board on April 5th, 2023 for use by AEMTs and Paramedics. This rollout was supposed to take place during July's protocol update. However, due to the continued shortage of albuterol, it was necessary to implement Xopenex sooner than the scheduled rollout in July. Indications. Xopenex is a bronchodilator that can be used to treat bronchospasm and can be used to treat asthma and COPD. It works by relaxing the bronchial smooth muscle. It is a beta-2 receptor with some beta-1 activity. Xopenex has a higher affinity for beta-1 and beta-2 adrenergic receptors than racemic albuterol. Xopenex is administered via small volume nebulizer. On this screen, we see the protocols that Xopenex can be used for. Essentially, it can be used in place of albuterol for any of the protocols listed on the screen. This includes allergic reaction, drowning, hyperkalemia, respiratory distress, pediatric allergic reaction, and pediatric respiratory distress. In all cases, we see that it is 1.25 milligrams in 3 mLs nebulized. Xopenex can be repeated. For all protocols except for hyperkalemia, it can be repeated until improvement. For hyperkalemia, we just go ahead and give it continuously. With Xopenex, there are some adverse effects. This includes tachycardia, palpitations, anxiousness, tremors, nausea, and vomiting. There are some contraindications to this drug, the big one being hypersensitivity to levalbuterol or racemic albuterol. With Xopenex, there are a list of cautions that we need to keep in mind. First of all, there is a risk of paradoxical bronchospasm. If this occurs, discontinue and treat with an alternative therapy. It is important to note that paradoxical bronchospasm is different than inadequate response from a drug, so we want to be sure to distinguish from the two. Xopenex may increase thyroid activity in patients with hyperthyroid, and for patients with diabetes, beta-2 agonists may increase glucose. There is a risk of hypokalemia, however, this is usually transient. Xopenex may increase CNS activity and excitation, so we want to use caution in those with seizures. There are some cardiovascular effects. Xopenex may cause elevation in blood pressure and heart rate, so we want to use in caution in patients with cardiovascular disorders such as arrhythmias, hypertension, and coronary insufficiency. In addition, Xopenex can increase the risk of arrhythmia and EKG changes, including ST segment depression, prolongation of the QTC interval, or flattening of the T wave. Next, we're going to talk about some drug interactions. With short-acting bronchodilators, we want to avoid mixing them because of the additive cardiovascular effects. With beta blockers, beta adrenergic receptor blocking agents may block the pulmonary effect of beta adrenergic agonists, which may produce severe bronchospasm in asthmatic patients. Diuretics can lead to EKG changes or hypokalemia, and digoxin. There was a mean decrease of 16 and 22% in serum digoxin levels were demonstrated after single-dose IV and oral administration of racemic albuterol to normal volunteers who had received digoxin for 10 days. MAOI inhibitors, or TCAs, we want to use extreme caution in patients being treated with these drugs. The action of Xopenex on the vascular system may be potentiated. Now we're going to talk about pregnancy and lactation. There are no adequate and well-controlled studies in pregnant women, however, it can be safely administered. We want to closely monitor and adjust medications necessary. There are no available data on the presence of Xopenex in human milk, effects on a breastfed child, and effects on milk production. With that being said, we want to consider the developmental and health benefits of breastfeeding versus the mother's need for therapy and any potential adverse effects on the breastfeeding child from therapy or from underlying maternal condition. This brings us to the conclusion of Xopenex and the Xopenex rollout for the Southern Nevada Health District.